What's compassionate care? Compassionate care, I feel, is treating your patients like you would your family members.
Eventually, we're all going to get old, so you like to treat the patient with respect, how you treat your mom or your dad, or how you like to be treated when you get old eventually. So you want to be there for the patient genuinely, not just being as a job, but as a care that comes from within. Okay? To me, compassion is when you are willing to do more for others than for yourself. It requires a selfless, humble, and non-judgmental attitude to be able to share it to others.
For me, is to be able to meet the needs of your patients through emotions and feelings, and for them to be able to feel who you are and what you're here for through your emotions and feelings that you have towards them.
Often go through some very difficult and challenging times, especially on the spinal cord unit also, that I work on, and sometimes my coworkers are having their own personal challenges, but having a positive attitude, carrying a warm smile, and our driven dedication to our work, to our patients, and to our coworkers can instill a sense of spirituality and increase that person's faith.
One thing I wanted to point out is we have to identify the person's beliefs and practices. And once you identify that person's beliefs and practices, then you can kind of work on helping somebody nurture that. And one thing I wanted to lead an example of is, for instance, here in rehab, we're striving on making sure that people take care of all patients and not just the patients they're assigned. So what we want to do is lead by example, and we want to show those people how to lead by showing them that we're able to help others. And even when you're busy in times when you're really swamped, you never say no to helping others, whether it's your patient or not. You want to lead by example. You want to nurture their mind and start them off the right way. Otherwise, they will be stranded and they'll be stuck only working on their patient and not helping others. So one way that we do it here in rehab is we want to pretty much lead by example. We want to show them that everybody helps each other. We work as a team, and in that way we can nurture their practice and their belief, and all of us can work together and take care of our patients here in Vallejo Rehab.
Our patients start to trust us when we acknowledge their fears, anxieties, and concerns, and we take time to listen to how and what they're feeling. By being able to build that trust, we give our patients the opportunity to participate with their care, therefore they recover faster and heal faster and better.
One way that we can show our care and compassion to our patients is when we do a thorough assessment, so we can intervene with their conditions or their problems efficiently. And we look at the patient as a holistic being. We don't only consider their lab values, nor their medical histories, nor their physical limitations. We also consider their support system, so we know or we have a better picture of where they're coming from and what their situation is. And it is not just enough to intervene. We have to persistently intervene until their issues or their problems are resolved. And then we evaluate what worked in that situation and what needs to be improved. To me, that is an example of an efficient and quality nursing care that has a lot of compassion in it.
What is the impact of education to patients' recovery? To me, it's very important because education and teaching is what rehab all about. It's always been our purpose to restore some or all of our patients' physical, sensory, or mental capabilities that were lost due to illness, due to diseases, or injury. And to me, patients teaching is an effective means of helping our patients towards recovery. If I am able to send my patients home with adequate bowel and bladder control through time voiding, double voiding, through bladder training or bowel training, that is rehab. That is big.
Limiting the noise and getting their pain in control are some ways that we can create a healing environment for the patient, because it's proven that if someone feels comfortable and relaxed, they can rest easier and heal faster.
When we care for our patient, we do it with love and respect. For me, we should treat each patient uniquely according to their physical, emotional, spiritual, and cultural needs. For me, nursing is not just a job, it's my passion.